Joining us now, Dr. Sreedhar Potarazu, Vital Spring Technology CEO. It is great to see you, as always, Dr. P. Thank you for being here.
Thanks for having me back.
Let's talk about this. This merger is a business decision or a political one?
Well, I think it's a business decision in response to a political one. Not too long ago, you had WellPoint and Cigna that made some pretty big acquisitions to get into the government market. And Aetna's got to do the same. That's where the money is. They're under a lot of pressure with the implementation of the new law to spend more on patient care, to take on more people with pre-existing conditions. So a key way for them to drive revenue is for commercial companies in the private sector to go after the government market, and that's Medicare and Medicaid.
So that's it. The expansion of Medicaid and Medicare is really where the money's going to be in the healthcare sector, isn't it?
Well, absolutely. I mean, if you look at Paul Ryan's proposal in terms of driving more competition in the Medicare market as one proposal for trying to reduce cost, if you look at the states that have to expand their Medicaid rosters, at least the ones that choose to comply, there's going to be a lot of activity in terms of the commercial insurance carriers getting into that market in terms of getting more covered lives. But the flip side of that is that they're also getting a lot of pressure from hospitals who are raising their rates for insurance companies. And so you're seeing a number of these dynamics roll in that are forcing the insurance companies to start gobbling up the smaller ones.
Well, and we start seeing that, right? WellPoint agreed to buy Amerigroup Corp for $4.46 billion last year. Cigna Corp agreed to buy HealthSpring. So we're seeing consolidation in the industry, right? At the end of the day, though, doesn't that mean less choice, higher costs for us at home?
Well, you got it, Tracy. That's exactly what's happening. You know, we tried to go after this, raising more competition to try and keep prices competitive, but it doesn't take much to figure out exactly what you said. When you start consolidating the market and you don't have much choice anymore and start creating monopolies, well, then they start to dictate price. So this is what they're doing by forming, bigger insurance companies, by some of them coming together. The insurance companies themselves are out there acquiring either hospitals or doctors' practices, so that for the average consumer watching today, while we're trying to push them to get more choice, in reality, a few years from now, they're going to have less choice and higher cost.
You mentioned Paul Ryan's plan to give vouchers to purchase private cares and things like that. Do you actually think that would work?
Well, there was a study that was published in the Journal of the American Medical Association that validated, when they looked at Medicare Advantage versus Medicare in terms of whether that kind of system would work. Lo and behold, the results were rather shocking to the Harvard economists, some of them Obama supporters, that Medicare Advantage actually did better than standard Medicare. So there is actual evidence to show that that kind of system can work. The second thing is that if you look at the corporate sector, many employers today have used that model of defined contributions, giving a set stipend or a set payment to employees to go out and buy health insurance. So it's not a new concept, and there's enough evidence now coming out to say that that could actually work in terms of driving competition and bringing down cost.
It's really interesting that prior to Paul Ryan's nomination, we were barely even talking about Medicare, Medicaid, and now all of a sudden it's front and center again. I mean, do you think that we're going to carry this wave all the way to the polls? Is it hitting a nerve?
Absolutely it is. And there's no question that you're hearing a lot since the announcement of Paul Ryan about whose plan is actually going to be the one that ends up winning the votes in November. I think that the one who is able to defend the math behind the Medicare solution, how seniors will not be able to lose Medicare, will actually be able to pay for it and keep the country solvent and not become bankrupt because of Medicare, is going to be the one that ends up winning at the ballot box in November.
I hope you're right about that. Dr. P, thanks for being with us.